So what you first do is you walk into the room and they're going to be lying face up. Now, in advanced pregnancy, you're going to want to turn her quickly. And normally you're going to say, turn over to your side. And then she may ask, what side? And you're going to respond with whatever side is most comfortable to you. Okay? And sometimes they just automatically turn without being instructed which way to turn. So, Jessica, I want you to face me, roll over on your side, okay? And you're going to hold the drape to keep her nice and covered up. Now, I have a 33 width table here with a lot of nice padding. I know that most massage tables are 31 or narrower. I like having the wider tables for this kind of circumstance. So I'm going to walk to the back, and because I want to take advantage of the width of the table, I need her to move back. So what I'm going to do is I'm going to ask her to move back, and you're going to place your hands underneath the sheet or by the sheet to where you can say, Jessica, I want you to move back until your back touches my hands. If you don't do two hands, that's good there. Sometimes you get the hiney end, very good, at farther back or the back end farther back. You want to get her as nice and parallel to the edge of the table as you can, which she looks really good. So the first thing I'm going to do is I'm going to take one pillow. And I want y'all to notice that the pillow naturally has an open end. The open end is always away from the face. So I'm going to have her lift her head, and I'm going to put the pillow down. Thank you. And I'm going to have her bottom hand appear, and you're going to place the wrist against the pillow, because this is going to be a whole lot more comfortable on her shoulder than just having it on the table like that. So this is going to serve a purpose. The next thing I'm going to do is I'm going to take 2 or 3 pillows, and I'm going to guess based on her shoulder height that I'm going to need 3, because these pillows are fairly flat. And so a lot of it depends on not only her shoulder height when she's laying on the side, but also the loft or the size of your pillows. Now keep in mind, in a clinical setting, she's going to be without clothing, so you have to position it to where it keeps her nice and covered up. So I like to kind of take a few steps. And again, the edge of the pillowcase is away from her face. They're all at this end here. So let me see your top one, please, Jessica. You can put it on the top pillow. And you can help adjust it if you need to. Ultimately, you can have her leaning a little forward, so when you start the back massage, you can have easier access to the back. And I like to have also kind of like Princess in the Pea, which is my nickname. I like to have everything kind of away from the face, and so she's nice and comfortable, which I have here, and you can kind of see that. Nice and comfortable there. Okay, so we've taken care of the head and the bottom arm and the top arm. Now we're going to start working with the lower legs. So I have, again, 3 more pillows because they're flat, and I'm going to place them underneath the sheet and the blanket. And yes, I always use blankets because I like the weight of the blanket on the client, and it's also going to assist with secure draping later. Okay, so Jessica, I want your bottom leg to stay straight and parallel with your body, and then your top leg is going to be bent and placed on the pillows. Very nice. Now I want you to see here that her hip and her knee and her ankle are almost in the same plane. In fact, I could probably even push this down a little bit to make it more comfortable, but that looks really good. Now I have another small, this is actually a cervical pillow, but I like to use it for the bottom leg. And I have to find it. Here it is. She has socks on. She must be cold. So I put this here again. The hip joint's going to be able to relax more when it's supported by the pillow. So here we have just a really quick overview. We've already seen it without the draping. You have the bottom leg bolstered. You have the top leg knee bolstered on 3 pillows in this case. You have the arm bolstered with 3 pillows, and then you have the head in all in a neutral position along with the bottom arm. Now, so what I'm going to do is, let's say we're going to start with her neck and shoulders. And in fact, the sideline position is an excellent way to massage the neck and shoulders, even with your non-pregnant clients or your clients that you're going to want to put in the sideline position for other medical reasons. Stiff neck, cervical fusion, if they don't like the face rest, like if they have a sinus infection, any kind of condition where they don't want to be prone. Okay, so what you would do is you would undrape the arm here, and you can actually get the entire arm this way. You can also get the neck and shoulders this way. When this is done, I'm going to re-drape it, then going down to the leg. Now the leg draping, find the leg, and I like to kind of do a teardrop because you want to get all the way up to the glute area here. That's her greater trochanter. So here you can actually do the entire leg and thigh and foot. So when you're finished massaging here, you're going to re-drape this area, and now we're going to go around and you come to the bottom leg, what I call the bottom leg. And here you may have to pull it out a little bit, although hers is in a really nice position. And again, you would drape it just like you would if she was prone or supine. So keep the drape nice and comfortable. You can massage the entire leg like this, down to the foot. And while we're here, remember to avoid a lot of heavy pressure on this point on the foot between the heel and the ankle. So this is the uterus point in reflexology, okay? So when this leg is finished, you're going to re-drape it. When you get to the back, it's really kind of nice to have the blanket because, again, it helps secure the drape. You're going to find her sacrum. You're going to drape down to her sacrum here. And this is the perfect way to do the back. Now, ideally, I would have a stool. So, because it's very nice to have good body mechanics when they're prone or supine, but now I'm in a sideline position, my direction of force is going to be across. So, I like to be sitting in a stool, and you can access all these wonderful muscles. Pregnant women love to have their low back and sacrum worked on, which you can do here. So really, in the sideline position, you've done arm, both legs, back, one shoulder. You can kind of get this other shoulder, and then the neck. So what I'm going to do now is I'm going to take the pillows away. There we go. We're dropping on the floor. And then raise this up just a little bit for me. There you go. And then anything that would be an obstacle. This is why you always remove your bolsters before you turn your clients over or before they get off the table too, because you don't want them to have to deal with that when they're trying to get up. How are you doing? Okay. I want you to scoot toward me. And remember, you have to ask them to scoot toward you before you have them roll over, because if she were to start rolling over, she'd go, ah, off the table. We don't want that. So you have to instruct them, scoot over toward me a little bit. There you go. Now roll over onto your back. Very nice. Just go over this way a little bit more. And now face away from me. Turn on your side. Wonderful. And we're not going to re-show the bolstering because we've already done that. But when she's into the second position, all you have to do, because you've already done the legs and the bottom arm, you're going to do this arm and then the neck and shoulders. Again, I like to finish with a little bit more back work. Okay? And I hope you enjoyed this demonstration and enjoy massaging your pregnant clients.